transplant is improved. In the last years, we start to do an automatic computer and robot approach to hair transplant. And of course, the strategy in the donor area is the same for the FUE, is the dissection under the vision of microscope, and also with the extraction of the follicular unit with a machine or manual or with a robot. You have to take care of the safe zone, and of course the strip is very nice procedure. If the patient has a very good quality of the elasticity of the skin, of the scalp, you can have very good results. But of course, we are going to have a linear scars. In more than 90%, you can have very good results in the scars, but sometimes you don't have. This is the result we have with the FUE, a patient of mine 6 months after the surgery. Also in this patient with FUE, more than 1,000 of grafts. Also this patient in the vertex. Even in the female, you can have very good result, even she has a very thin hair. At the moment, I like in female to use a long hair, not in FUE, but FUE. And like you can see all the time that the surgery is doing, if you are going to have the result with the density of the hair. Also at the beard, we have improved when 10% of our patients at the moment, they asked for beard surgery. This is the result, the density, the quality, and also the natural of the result. Also, this patient is a 74 years old, and they asked for beard surgery, and you can see how nice is the result. Also, we like to do the beard with the long hair also, because you can feel the direction of the hair during the surgery, and this is after the surgery, immediately after the surgery. But this is the question: why change if you are having excellent results with FUE? In the strip, the FUE, you have some limitations. When the patient has a low elasticity of the donor area, in young patient, because the skin is very stretched, and sometimes you can have a bad result at the scars in my hands. And also the limitations in the secondary surgery, where you don't have a nice elasticity of the scalp. But FUE is a long and complex learning curve for surgeon, for assistants, logistics of the surgery, and instrumental. And this is the key points: direction and the angle of the hair, depth and diameter of the pinch, uniform extraction in all regions. This is very important to keep in your mind. Varying per square centimeters, extraction techniques, and avoid extraction in small areas because you can have some problems. When you decide to do FUE, you have to shave the hair, you have to program and like a map in the scalp and to extract this hair. You use an automatic machine, but we start to do first with manual, then we remove some grafts, see the direction of the graft, see how deep is the graft, and then we start to do with automatic. And this is the punch diameter you have to choose for each patient. In this video, or the video doesn't go, please, the video. Okay, in this video you can see the direction, you can find the direction of the hair and also the angle. With the good direction of the hair, you can extract the follicular unit without damage. You have to cut until the pillar's muscle. And if you go in a different angle, you can cut the hair and you can lose some grafts. And here, like you can see here, is the surgery. It's not a static surgery. You have to move all the time with the direction of the hair and also with the angle of the hair. In 1 centimeter square is very different. The angle of the follicular unit, also the dip, and also the angulation. And here is the machine. Like you can see, you have to move all the time. The machine at the beginning, we choose the dipper. Usually is 3 millimeters is the dipper. It's a nice dipper for you to remove, to extract the graft. And you have to move all the time. And then you have to use a special forceps to remove, to take out. This is the result 3 days after. In a patient, we put around 1,000, and you can see, like you can see this area, the donor area, it's no scars, and you can see this healing in 3 days after the surgery. This is 1 day post-op, 4 days post-op, and 8 days post-op. It's fantastic, the result. In this patient, 15 days after the procedure, no scars. The grow of the hair, you don't need to see the scars. And this is the result in the young patient. It's around 1,000 grafts in this patient, 6 months after. Also in this patient, we can have good result, good quality, and also the density. Of course, this patient had a very strong hair. And also in the patient, a young patient with a thin hair, we can have a very nice result. The result, what you need to do is the planing the hairline and planing the type of the baldness. And sometimes FUE open horizons associate with FUT. And sometimes you can have more than 2,000 grafts in 1 day in a very large grade of baldness. This is my current approach at the moment. FUT, we have been doing only in 20% of my case, and FUE is improved. We have been doing in a 60% of all of my patients is FUE alone. And in 20% I associate FUE and FUT, but this combination is going less in my clinic at the moment. And like you can see this patient, they did the both surgery. You cannot see the scars, you cannot see the scars in FUT and FUE if you would have a very good plan for the beginning of the surgery. In conclusion, approach the donor area should be as natural as possible in FUE, preserving the maximum the follicular unit. The FUT, the strip, and FUE methods has its indications, sometimes associated according to the experience and preference of the surgeon and the patient's wish. Thank you very much for your attention.